Hi, my name is Michael, and I'm presenting today on misinformation spread and a specific type of misinformation spread that specifically focuses on misinformation that uses scientific authority or credibility to promote its false claims. And this is all based on research that's presented in this paper that's under revision currently and is titled Identifying and Characterizing Scientific Authority-Related Misinformation Discourse about Hydroxychloroquine on Twitter using Unsupervised Machine Learning. And this work has been done under my work as a graduate student at UC San Diego in the Department of Cognitive Science, as also with collaboration with the Global Health Policy and Data Institute, which is also associated with UCSD. So for some background on this project, so on July 27th, US President Trump at the time retweeted a video falsely claiming that using hydroxychloroquine was a cure for COVID, despite well-documented concerns saying otherwise. And this retweet is also related to a broader COVID-19 infodemic that involves deliberate attempts to disseminate wrong information that undermine public health response. So Trump's retweet is kind of indicative of a larger infodemic going on in tangent to COVID. And this study focuses specifically on misinformation that uses scientific credibility to back its claims. So before kind of going into the methods, I kind of want to briefly explain like why is this study kind of focusing on scientific evidence and kind of understanding the motivated reasoning behind that. So there's been a long history of scientific evidence or scientific credibility being used to promote claims that aren't necessarily scientific accurate. For instance, the Tobacco Industry Research Committee, the TIRC, in 1953 was formed to promote scientific research that contradicts the consensus that smoking kills. And by 1986, they had spent over $130 million on sponsored research, which resulted in 2,600 published articles. And again, that was by 1986. So I'm sure that number has increased since then. On the industry side, there was Edward Bernays, also known as the father of public relations, and he reported that he was able to find physicians willing to state publicly that a hearty breakfast, which included bacon, was healthier than a lighter breakfast, with the full knowledge that a large number of people will follow the advice of their doctors. So getting doctors to promote that bacon is healthy for you, even though that's not necessarily seems to be the case. And then another example, and this image was taken from when Bernays was on Letterman during 1985, and he was introduced as Dr. Bernays, and Letterman asked, like, what is the doctor in? And Bernays replies, what we are really dealing with here is the concept that people will believe me more if you call me doctor. So again, the idea that like you can, people add more weight to when someone evokes scientific credibility or medical credibility. And this is, and then not only that people are aware of this, but they take advantage of that despite if the claims don't actually coincide with scientific evidence. And then also, there doesn't really even appear to be that much research on that examines scientific authority, or especially within the context of misinformation spread. So there has been some previous survey data that looks at how deference towards scientific authority is influenced by media, and also that the more deference one has to scientific authority, then that drives their support of biotechnology. But there isn't really that much work that kind of explicitly looks on how misinformation and scientific authority is used together. So this is just a brief overview of the methods. I'm going to kind of expand on all these points further along. So just for one, we collected tweets using the Twitter API, using hydroxychloroquine and chloroquine as keywords. We use a time frame between July 21st to the 31st. And this is between the time frame when Trump sent his tweet on July 27th. Since we also had such a large volume of tweets, over 2 million, we use an unsupervised machine learning approach called bit-term topic modeling. And this is a type of natural language processing technique. And this categorizes tweets into highly correlated topic clusters based on their textual similarity. Again, we'll have another slide further down that kind of goes into more detail about this process. Then once we have the topic clusters, we take the top 10 most retweeted tweets that were extracted from each topic cluster, and then we manually coded them to identify scientific authority themes. And this includes medical endorsements. So someone saying, as a doctor, I support the use of hydroxychloroquine. Supportive scientific evidence. So this is evidence that supports the use of hydroxy. And then opposing scientific evidence. And this is kind of as a comparison group. And this is evidence that opposes or discourages the use of hydroxy to treat COVID. And then topics that had at least 50% of their top tweets that had one of these scientific authority themes were then chosen for further analysis. We also wanted to measure just replication of messages in general. So we had this measure, we called it echo score. We used this in previous research as well. And this essentially does is takes the total number of tweets and divides it by the number of unique tweets. So by unique tweets, it's just the number of tweets when the retweets are removed. So instead of having the same message that was retweeted 1,000 times showing up in the data set, you only need to have it actually, if the text is just, we'll just have the text show up once and then essentially just have it as a count that it was tweeted 1,000 times. So this again essentially sees just the ratio between number of actual unique messages in the corpus versus how many times are replicated throughout. So this is the timeline from when we collected our data. So as you can see, hydroxychloroquine discourse was pretty low or mild before July 27th. And then after Trump sent his retweet, that was again of the viral Breitbart video featuring that was basically supporting hydroxy usage. Suddenly there was a sharp increase in hydroxy-related discourse. We also looked at another data layer called, this was from the Stanford Cable TV News Analyzer. And essentially what this resource does is that they take 24/7 broadcasts of CNN, Fox, and MSNBC and continuously transcribes what's is being broadcasted on those networks. And then essentially you're able to then identify different keywords and see how often different words come up across these 3 different channels. And then as you can see around this study timeframe and kind of after Trump sent his tweet, not only did it increase the volume of tweets on Twitter, but also it increases the discourse and discussion happening across these 3 highly watched cable television channels. So this also kind of shows that not only was the information wasn't, or Trump's misinformation tweet wasn't just limited to Twitter, it also kind of expanded outside Twitter onto other media platforms. So again, to go over the bits from topic modeling and just kind of go over some more detail about it. So we collected over 2 million tweets, so we had a large volume to go through. So we used the topic clustering to be able to basically cluster the tweets together to be able to look at more higher level themes throughout the discourse. And this also allowed us to be able to understand what's going on in the Twitter discourse without having to code all 2 million tweets. So BTM works by splitting the text into a bag of words and then producing a discrete probability distribution of all the words for each theme that places a larger weight on words that are more representative of the given theme. So while more traditional NLP approaches uses unigrams or bigrams for splitting the text, BTM uses what's called bit terms, which is a combination of 2 words from the text. So for instance, the phrase go to school would be 3 bit terms. So go to, go school, and to school would all be considered 3 different bit terms in the analysis. And this just kind of captures the co-occurrence of the words together. And this is how the textual similarity was quantified. And this is basically was the basis for grouping the tweets together. Also for BTM, you also have to set the number of topics as well, since it's an unsupervised machine learning approach. And how we decided the number of topics was just used what we call the coherence score. And this essentially helped us decide to use 20 topics for grouping all the tweets together. Then to go over a little more detail of the scientific authority themes that we coded for. So this just kind of gives a little more detail of how we coded each tweet. So for medical endorsements, again, it's evoking medical authority or expertise when supporting the use of hydroxy as a COVID-19 treatment. Scientific support presents scientific evidence and findings supporting hydroxychloroquine use for COVID. And then scientific opposition, so scientific evidence that is discouraging the use of hydroxy. And we defined scientific evidence in this study as findings obtained by scientific method or scientific instruments based on scientific theories used to prove a specific claim. And here are some examples of the tweets that were coded for each category. So for medical endorsement, an example of a tweet for that was, infectious disease specialist doctor, redacted, hydroxychloroquine is the beginning of the end of the pandemic. So, this doctor then announces that, hydroxy is a game changer in the battle against COVID. Scientific support example of a tweet was the first one. So we have more evidence presented for why hydroxychloroquine should be made available in a new court filing by the Association of American Physicians and Surgeons. Then scientific opposition examples. So we have, debunking hydroxychloroquine in all caps. So, the stance is pretty clear on that one. The viral HCQ video today is a time to bump up this thread on the mega recovery randomized trial of HCQ with 4,700 people showing no benefit for mortality and even higher risk of ventilator mortality. So again, scientific evidence in opposition. Then we also coded for hydroxy sentiment. So this is just kind of whether they have a positive or negative reaction towards hydroxy usage in general, especially in COVID context. So a positive sentiment example of a tweet of that is, zinc, vitamin D, vitamin C, and hydroxychloroquine are not the cures, but a vaccination that was quickly made and not tested on animals is. So, not only kind of throwing in some anti-vaccination sentiment in there as well, but, still kind of showing this support for that usage. And the negative sentiment example, the drug doesn't work as a prophylaxis. As a preventative, it doesn't work in the treatment of early disease, and it very convincingly doesn't work in hospitalized patients. We can definitely say hydroxychloroquine doesn't work. So, this one definitely takes a hard stance against hydroxy. So here are the results. So of the 532,199 users associated with this data set, 88.3% were engaged in topics that express positive sentiment towards hydroxy, compared to only 5.5% that expressed negative sentiment. Also, of the 2,289,441 tweets that were collected for this data, 18.04% were within topics that featured predominantly medical endorsements for hydroxy. 1.34% featured scientific evidence supporting hydroxy usage, while less than 1%, so 0.51%, featured opposing scientific evidence. So in general, the majority of the discourse in terms of positive sentiments or the majority of the discourse leaned towards positive sentiment towards hydroxy, as well as that the misinformation themes were much more prominent compared to the scientific opposition control group. And here's some examples of the different topics that we use for analysis. So again, we had 20 topics in total. We selected 8 that had at least 50% of their top 10 retweeted tweets that were within one of the 3 scientific authority themes. This slide shows the first 4 topics that we used, the other 4 on the next slide. And this shows the top 3 retweeted tweets for each topic. So this again gives you just a general sense of what the general discourse was for each topic. We also showed the retweet column. So this is the tweet, how much times it was retweeted, the sentiment that we coded for, the theme that we coded for. So this is, medical endorsement, scientific support, or scientific oppose, as well as the percent total volume of that tweet for that topic. So this just kind of gives you a sense of which tweets were more prominent or were treated more often within each discourse. So for these 4, the majority are either medical endorsement or scientific support. And then these are the other 4 topics that were used for the scientific authority analysis. And this shows the one topic that is predominantly scientific opposition on the bottom for topic 24. So again, this kind of reiterates the point that the medical endorsement and scientific support topics were outweighed the scientific opposition. This analysis shows also or at least compares the timeline of the discourse. So for the timeline you can see below, this not only reiterates that the medical endorsements and that were in red and the scientific support that are in blue have a much higher volume than scientific opposition. So we already kind of reviewed that in the previous slide. But as you can see by comparing the different peaks throughout the discourse, that the duration of the medical endorsement and scientific support topics went on for a longer time than scientific opposition, where if you kind of zoom into the scientific opposition or kind of get closer to your screen, you can see that there's about maybe 2 peaks in the beginning, and then it tapers off past July 29th, while the medical endorsement and scientific support discourses continue on for a longer time. So not only do these misinformation themes have higher volume than the scientific opposition, but they also go on for a longer time as well. The table on the top also shows echo scores for the different topics. So this kind of just groups together all 8 of the topics based on their different groups. So medical endorsement is like the 5 topics that were categorized as medical endorsement, scientific support is the 2 topics, and then scientific opposition is that topic 24 below. So as you can see, the medical endorsement does have higher echo scores compared to scientific opposition. And this indicates that, higher echo scores of retweets indicates higher levels of retweets without additional commentary compared to, so in general, there was a lot more consistency in the messaging and medical endorsement compared to scientific opposition that had a lower echo score. Then we also looked at the accounts that were associated with the top 10 most retweeted tweets per topic. And we found this account information. This was just basically whatever information that they have publicly available on their Twitter profile. So we coded for job affiliations. So we looked at 4 different categories. We looked at media. So if they were affiliated with a media or media outlet, if they declared if they were an MD or a scientist on their profile, whether they also associate with a political organization or politician, and as well as if they expressed explicit support for President Trump. And this was quantified by just literally if their profile had the phrase something like hashtag Trump 2020, hashtag MAGA, or if they had a picture of Trump on their cover photo or even profile. So as you can see, the medical endorsement and scientific support topics both have a lot more influence from Trump supporters, as well as media and even political organizations / politicians, while the scientific opposition group is mainly driven by scientists or MDs. There is 10% of it that did have some Trump supporters. However, we looked into this and they were actually, the one account that was in that scientific opposition group was actually the minority view on this stance. So they were presenting scientific support in this one topic. So so it wasn't necessarily a case where there was a Trump supporter who still thought hydroxy was bad. This was someone who actually was saying that hydroxy was good, and they were just the minority voice in this particular discourse. So for a summary, the majority of the hydroxy Twitter discourse revolved around topics that were expressing predominantly positive sentiment towards hydroxy usage. And the misinformation topics such as medical endorsements and supportive scientific evidence were much more prevalent compared to the opposing scientific evidence. And also topics with high levels of hydroxy support also had higher echo scores, which indicates that the misinformation from the tweets were transmitted more consistently across the communication network. And these results showed that not only the misinformation is prevalent on online discourse concerning drug treatment for COVID-19, or at least showing another example of that during the wider infodemic, but also shows that scientific authority in the form of promoting medical authority or questionable scientific support is evoked often to substantiate these false claims. And these are important because like even with a scientific background, like it can be difficult to assess the credibility of a study or statistic on social media platforms, and especially if it's based off in a field outside one's domain of expertise. And also even for people who don't have formal scientific training, this problem is exacerbated even further. So future research really does need to kind of focus on misinformation during health crises that use scientific credibility that makes false claims. that is particularly using this viral form of misinformation that is very hard to discern, even for people who do have formal training in science. And this slide I also kind of include just to kind of zoom out a little bit and kind of even just kind of ask a question, like why is doing research on Twitter or social media in general important? And this slide or this data was also taken from the Stanford Cable TV News Analyzer. So the same people who are constantly analyzing or making transcripts of CNN, Fox, and MSNBC. So for this query, we looked at just the words tweet, tweeted, tweeting, and tweets. And this is basically just to see if how often a tweet is being reported on the cable news networks. And as you can see that the amount of tweets, the time that tweets were mentioned on these broadcasts, and this is going from January 2010 all the way to January 2021. So it's a pretty big timeline, especially for social media in general. As you can see that there is a steady increase of how often a tweet is reported on these media platforms throughout time, and definitely particularly spikes after January 2017, which I don't think non-coincidentally is after Trump was inaugurated, since his tweets were highly reported pretty consistently. And actually looks like it actually has decreased a little bit since he left office, but still this kind of shows that what happens on Twitter, what happens in social media is not happens like in a vacuum. They're all kind of connected. So whatever is happening on a social media platform can easily spread off to not only other social media platforms, but even onto traditional media outlets such as cable television. So especially in terms of misinformation, it's whatever can start on Twitter can then also kind of maybe be a narrative or misinformation that then spreads out to a lot farther reaches. And yeah, that's all I have to present today. So thank you for listening to my talk. And if you have any questions, feel free to reach out. Thank you.